mean, I've worked in care for nearly 20 years, and it was the most sensible thing I've seen for the majority of that time. So we admitted a gentleman into our home after receiving a referral from William Harvey Hospital. When he arrived, it quickly became apparent that he probably wasn't medically fit, really. So we contacted an ambulance crew for their support, because he had a lot of behaviours that we just couldn't manage safely. An ambulance crew came out and they were just an absolute breath of fresh air. Immediately agreed that he wasn't suitably placed and said, right, let's call the hub. At that point, I had no idea what that meant or what that was. It was fine, you know what you're doing.
There are a lot of good things happening in this because of this hub. Okay, like we are giving the appropriate care for the patients. When the ED consultant and the priority team and the urgent care services, we will all sit together with the paramedics and we can make a decision for them whether that patient requires a hospital treatment or whether we can sort it in the community.
After about 2 hours of them negotiating with this hub, they were able to take this gentleman back to the ward that he was discharged from, so that his case could be re-looked at and discharge plans could be made at a more appropriate time.
If we hadn't had the ED consultant in the room at the time and we didn't have us as a hub, they would have had to have taken that patient back to A&E, which wasn't the right place for him. He didn't need A&E, he needed continuation of care in an appropriate facility, and that needed to be put in place, but that wasn't something that we could do from our service, but he needed to go back where he was discharged from, really. So yeah, that was quite a beneficial example.
They had so much confidence in the team that they were speaking with as well, because when they were hanging up the phone or waiting for a call back, but that's okay, so-and-so's on that, yeah, they'll be on that. So it was just such a relaxed experience.
The main point is to give the better care for the patients. Okay, so I feel better because we are giving the appropriate care. There is no need for them to come and wait in the emergency department for hours to get that treatment. Okay,
it's just the way it should be. It just seems so sensible when you consider it now. We just have everything bottlenecking into one position to probably 90% of the people in accident emergency are going to go on to somewhere else, but all having to just go through that one point that gets so congested and is so stressful and so difficult for people. So I just thought, yeah, it's amazing, and why weren't we kind of doing that years ago? When you hear it, it seems so sensible.
It's rewarding and educational to see the other side of healthcare and all the things that go on in the background, like that discharge. I ended up sort of like quite involved with social services and like the discharge nurses and different pathways and different beds that they can be discharged into, which I had no idea about previously. So that was really beneficial as well.
I've always been around the challenge between social services and the NHS, that you were trying to discharge people from the NHS into social services, but different funding body. But this just feels so sort of joined up and sensible, and I guess it's going to be largely within the NHS, so that you have the control of those different elements. But no, I just think go for it, and let's hope it spreads across the country.